Often during consults, I hear a question from patients about how the nose ages and the ear ages. And there's a lot of misunderstanding about what actually happens. The nose, for most people, does not really grow so much with time. There are exceptions on patients who have thicker skin over time, like with rhinophyma or acne, where they end up getting bulkier skin over time. But generally, the cartilage does not grow to any substantial extent. However, with age, we lose structure. And just like you would have perkier breasts when you're younger and they tend to get kind of saggy and droopy as you get older, the nose can do the same thing. This happens because the skin thins, the layers deep to the skin can thin, the structure holding the nose together can thin, and it gets a little bit weaker. So you end up seeing more shadows around the middle vault over here. You see the bone a little bit more, it becomes more prominent, and the tip starts to sag down just like the droopy breasts. So that's the case with most people, and I advise most patients, if you have minor changes over time and you were happy with your nose before, just leave it as is. You don't need to operate, you don't need to do filler, you don't need to do anything. On some patients, you can get a mild, tiny change with just putting a touch of filler in. And other patients, they had a nose they didn't like before and it becomes more exaggerated as the skin thins and the nose tip droops. And yeah, they can go get rhinoplasty at some point, although those patients specifically might need a little soft tissue augmentation, like putting a fascia graft on the bridge or something like that. So that's the reality of nasal aging, regardless of what you've heard in the past. There can be some growth, but it's majority of the time it's just kind of drooping and thinning of the tissues and the support structures. The ear similarly goes through some drooping, and you can get thinning of this area that we call the helix. The helical skin can get thinner over time. The earlobe can enlarge slightly over time, and it can droop over time. Most women actually get thinning of the earlobe, some wrinkling, and as the neck goes down, it pulls the ear down with it. And you can actually get a little bit of what we call a double lobe. So you have a lobe, but then you get this other little mini lobe in front of it. That's pretty common. Uncommonly, but not impossible, you can actually get growth of the appearance of the ear because the earlobe on men, for example, just gets a little bit bigger or fattier over time. That's less common, and if that happens, you can perform an earlobe reduction surgery where you go and just kind of cut around, trim little areas to make the earlobe the shape that you want. You don't really want to do those surgeries where they cut into the middle of the earlobe and do a wedge resection. That doesn't look so good. Most of the time during a facelift, this is addressed, where you do a facelift and the earlobe, which was drawn down like this, is taken back up because the neck and the face are no longer pulling down on it, and the parts that were shrunken down you can re-inject with a touch of filler or fat. The filler you don't want to put in the earlobe, you don't want to put radius, and you got to watch out for the classic juvederm in there. It tends to get a little white. Otherwise, you can use Volura, Volbella, Bellotero, anything, but very, very small amount is really all you need. Most people require less than 0.5 milliliter on each side to refill, and you can actually even do the skin around here. It depends how in tune you are with wrinkles and if you really care about this stuff. So moral of the story, don't worry so much about little changes over time unless you were bothered by them already. If you're gonna do a facelift, just make sure your earlobes are addressed at the same time so you get everything looking matchy-matchy.